Well, just by way of further brief introduction, I am Ron Hoppe. Our organization, Worldwide HealthStaff Solutions, is working with employers just like you in rural communities all across the country. And I, look forward to sharing some perspectives that we've gained working with them, and also, as I said, in hearing from you. The topic for our time together this afternoon is the nursing shortage goes way beyond headcount. Now, just off the top, that might almost seem like a bit of a ridiculous statement, because today everybody is faced with a profound shortage of nurses. Period. There's just not enough uh, there's just not enough applicants to respond to the number of open positions that need to be filled. And that's true. And much of this has been compounded by the impact of the pandemic. But the presentation this afternoon is in the context of pre-pandemic and post-pandemic world. Many of the issues that we're going to touch on today were issues and concerns before we ever heard of any pandemic. As I said, certainly the circumstances currently have magnified some of these challenges, but I think we also need to contemplate what are some of the strategies that we can pursue in the foreseeable future, as the pandemic hopefully will be increasingly in our rear view mirror. So this afternoon, we're going to explore that shortage, but we're also going to explore another dimension to that shortage that is much less well known, and talk about strategies that you can use to address these issues within your facilities. Within the state of Missouri, specifically in rural Missouri, you're probably all familiar with some of this information, because I suspect you're living it each and every day. And Missouri is greatly impacted by the current supply and demand imbalance in the nursing workforce. And not only that, rural Missouri, as many rural communities across the country, are disproportionately impacted. In fact, a recent study earlier in 2021 found that rural Missouri counties have the highest percentage of nurses over age 54. That's considerably older than the average age of the nursing workforce. And the nature of nursing is such, in terms of it being physically demanding, that at this point in a nurse's career, the thought of retirement is probably not far from the forefront of the thinking of many. So this is part of the reality that you find yourself having to deal with each and every day. Of the 114 counties in Missouri, 97 are designated as healthcare professional shortage areas, the vast majority of these being in rural communities. And rural Missouri counties have a higher percentage of nurses over 54 compared to their urban counterparts, just reinforcing that initial point about the disparity between urban and rural centers. So this is the environment that we find ourselves in today. And just very quickly, to give you some indication as to what is going on in the country right now, the South, where we find ourselves, has or is projected rather to have by far the largest number of nursing positions open come 2030 in relation to any other region within the country. In addition to these data points and these projections, I think as we set the stage for our conversation this afternoon, it's also important to spend a moment and just understand that there are other major shifts underway in the healthcare system. First, we have the baby boomer generation, which is now at a point in their career where they are increasingly either reducing the hours that they are working or they are retiring altogether. In the time frame of 2012 to 2018, from this generation alone, from the baby boom generation, there was approximately 60,000 nurses leaving the workforce each year. By 2020, and this was estimated pre-pandemic, that number had increased to as high as 80,000. Now, this afternoon isn't just going to be all doom and gloom and talking about just the endless struggles that we seem to be having in this area. There certainly is some good news to be considered here as well, and that is that the number of nursing students in America over the last 20 years literally has exploded. At the beginning of the 21st century, in 2001, there was somewhere around 68,000 nursing graduates in the U.S. That number increased to by 2015, increased to 158,000, and more recently, as recently as 2019, the number of new nursing graduates in the country exceeded 175,000, I believe, for the very first time. Now, that is certainly good news. The not so good news is at the same time that there was 175,000 nursing graduates in 2019, 230,000 nurses left the profession during that same period of time. So while we have a tremendous number of new graduates entering the workforce, we also find that the number leaving is even greater yet, which is only adding to the shortages that already existed. Now we have the pandemic, and it's yet to be seen what the longer term impacts of the pandemic will be on the workforce. But nevertheless, I think it's safe to say that the numbers just simply don't add up. The Bureau of Labor Statistics projects that the nursing workforce of 3 million will grow by 7% each year from 2019 to 2029. So that is where we find ourselves right now. We're right in the middle of this. So if that analysis by the Bureau of Labor Statistics is accurate, in America, we're going to need, if we need 7% more nurses on a base of 3 million each year, that means we need 210,000 new nurses. But as I shared just a moment ago, in 2020, while the demand went up by 210, the new supply of graduates that actually went as far as becoming licensed was just under 173,000. So we can see, again, this deficit that we're facing continues to grow year after year. Demand, pre-pandemic, demand was growing 17% faster than supply. I think this point is well understood by everyone that's responsible for staffing your facility. But let me pivot a little bit and start to explore another aspect of what is going on in the workforce here, and then get us to a point where we talk about potential solutions. You know, we talk about the aging of America, the aging of the workforce, which obviously includes nurses as well. But when we take a look at how the age distribution is shifting across the nursing workforce, we see a couple of very interesting things. The fastest growing aspect of the nursing workforce is the novice nurse. That is the new graduate or someone who is very much at the front end of their career. That portion of the nursing workforce is growing more quickly than any other part of the nursing workforce. Then in this gray bar, we see that the second most quickly growing segment of the nursing workforce is those nurses that are nearing retirement age as their age continues to increase. The portion of the workforce that is actually declining in terms of the proportion of the workforce that it represents is those mid-career nurses. That would be a nurse that has 4, 5, 8, 10, 12 years of experience, still more than likely in the front half of their career. So we see the number of nurses nearing retirement is going up as a portion of the workforce, but the number of new grads and the novice nurses that have recently entered the workforce, they are growing even more quickly as a percentage of the workforce. And this, over time, is going to have some very profound implications for healthcare employers. In fact, research was recently done by a professor, Peter Burhaus. If any of you have spent any time studying nursing workforce issues in America, Professor Burhaus is probably the leading voice in this area of research. He's been engaged in studying the nursing workforce for many, many years. And he, together with some of his colleagues, did a study looking at the impact of this phenomenon that I just shared, where we have an increasing number of nurses leaving the workforce and increasingly being replaced by people that are very much at the front end of their career. And what his research found was the result of that was that each year in the United States, the total years of experience across the workforce was going to decrease and decrease significantly. In fact, if we look at this very simple chart here, we can see that starting in about 2019, 2020, and kind of projected out, kind of flat all the way through to 2030, these single dots, unconnected dots. Each one of these dots indicates that for that given year, the US nursing workforce is going to lose 2 million person years of experience. It's almost a number that is too great to comprehend. And just to really boil this down to its simplest form, this is the multiplied effect of having that 20 and 25 year tenured nurse leaving the workforce and being replaced by someone that maybe has 1 or 2 years of experience. If you were just looking at this on a spreadsheet, you would say, well, we had a vacancy, we filled that vacancy, we're good. When in reality, you've just had 20 years of nursing experience walk out the door. That's a big deal when it happens one time, but when it starts to happen multiple times, and in larger facilities 10 times and 15 times, say, in a year, you very soon start to have this new phenomenon that you're dealing with now, where you're starting to have an experience shortage in addition to the absolute headcount shortage that you had to begin with. All of this is happening. All of this is happening at the same time that the complexity of care that each of you is being expected to provide is increasing. Whether you are with an acute care facility, a long-term care facility, or perhaps some sort of a specialty inpatient facility, you will see and you will be experiencing that the acuity of your inpatient population is rising. It's consistent across all aspects of the healthcare system in America today. Just one metric here is that the non-ICU case mix index for 2012 to 2017, that acuity index increased by 11%. I think whatever care setting you find yourself working in, you can see for yourself that patients with multiple comorbidities is very much on the rise, while at the same time there continues to be this endless pressure to reduce the average length of stay in an acute care setting. So here's what we're dealing with. We have not enough people to begin with. The people we have are increasingly a novice in their profession. At the same time, we're being expected to provide more complex care, more sophisticated care at the same time that we're dealing with these other factors. The complexity of care increasing has given rise to a new phenomenon. And when we consider the increasing number of novice nurses in the workforce, together with the increasing acuity and pressure to decrease length of stay, and the growing importance of electronic health records, which has created an interesting phenomenon in so much as it's actually hastened the retirement of some late career nurses that just weren't prepared to make the transition to working in an EHR environment. We put all of these factors and considerations together, and we have something called the experience complexity gap that all healthcare employers across all sectors of healthcare increasingly find themselves facing and having to deal with. So you might say, well, that's great. I'm really glad you're speaking with us this afternoon. This is really cheering me up. But we do have the opportunity to take these challenges and now pivot to take a look at what some of the opportunities may be to start to close this experience complexity gap. And in our time, I'd like to focus specifically on what 4 of these opportunities to address this phenomenon are. So the first is to simply accelerate the transition from novice to competent. Accelerate the transition from novice to competent. This is a multifaceted thought and approach that really starts with the academic partners that you have in your communities, in your state, and even in your region, to the extent that you're able to attract graduates from these various institutions. We find ourselves in a place in 2021 where the number of BSN graduates is higher than it's ever been. The number of BSN graduates now significantly exceeds the number of associate degree nurses, but yet employers are finding that these newer graduates are less prepared to enter the workforce than at any time in the past. This is why we have seen the rise of nurse residency programs, extended internship programs, greatly extended periods of orientation. It's because the nurses that are being graduated today don't have the same level of workforce readiness that they've had in the past. And I would say that this is a significant opportunity for all health employers to band together and to work with your educational facilities and your educational partners to see what can be done to ensure that as these new graduates come to you and start to enter the workforce, that they can be making a meaningful contribution to your workforce as soon as possible. It's very important. I'm not here to criticize or to rain on nurse educators. It's simply where our system is at today. And given the urgent need to provide care at the bedside, it is imperative that we are graduating new nurses that are ready to enter the workforce very, very quickly. The other consideration under this opportunity for closing the gap is to double down on retention efforts for novice registered nurses. When we talk about retention in the context of healthcare workforce, it's usually focused on nurses that have been with us for a while, or we're talking about how can we retain late career caregivers for an extended period of time. That's kind of making sure we aren't losing people out the back door. But unfortunately, within the population of recent nursing graduates, they are leaving the nursing workforce at a much higher rate than even those that are on the brink of retirement. So when you think about retention, make sure that your retention plans extend to those that you have just hired and those that are at the very front end of their career. We've spoken with some employers around the country that have 60 and 70% turnover of new grads within 2 years. It's just unsustainable. You cannot function with that type of turnover in a time of great need. So examine what your current retention practices might be, where your retention focus may be, and be very sure to extend your retention strategy to address the needs of new graduates. Lastly, in terms of being able to accelerate the transition from novice to competent, is sometimes, given the shortage, employers are so happy that they've been able to onboard some new graduates that they basically uh, put them into a situation where they're expected to do things that they're simply not prepared yet to do within their limited experience. So streamline the list of skills novices are expected to learn or to complete in the first 12 weeks. Assign them work that they will be successful in completing, and provide them with that opportunity to grow in their role at an appropriate pace. The second opportunity that I believe employers have in closing this experience complexity gap, and ultimately also as a result of that, addressing some of the supply and demand issues, is to take a look at how your nursing experience is distributed across your organization. So the concept here is, what can you do to leverage your existing experience? It's very common. Studies have found in hospitals in particular that there is a great misdistribution of experience across various departments in a hospital. You will find in outpatient settings, in clinic settings, in some of the less physically demanding areas of an acute care facility. This is where you will find your most experienced nurses. Take a look at your facility, department by department, or wing by wing, whatever the case may be. Take a look at your organization by department and do an analysis of where is your experience really residing within the organization. Is it disproportionately represented in one department while you're struggling with a great lack of experience in another? Take a look at how your experience is distributed and examine what opportunities there might be to redistribute that experience across the organization. As I said, specialty units and outpatient settings tend to have the more experienced nurses working there. And see what opportunities you may have to move some of your more experienced RNs to units where you are lacking in that overall level of experience. So far we've taken a look at how to go about accelerating the transition of new grads from novice status to competent status. We've briefly taken a look at how is it that we can leverage the existing experience that we do have in our organization and use that to better support our workforce overall. Thirdly, the next opportunity I would like us to take a look at is simply differentiate. We're at a point in time where I think this idea of differentiation is no longer just a thought or something to be considered. I think it's almost an imperative at this point in time. Simply looking at our workforce differently. most simplistically, we could say that, well, we should be creating roles that maximize competent RNs and team them with novice nurses. This is not a new idea, but yet how often is there some intentionality within your staffing plans to ensure that this is actually happening? Of course, the retention of late career RNs is something that some employers have placed some emphasis on, but many have not. And it is absolutely essential when we talk about retaining late career RNs and the concept of differentiation. It simply says that part of the nursing workforce, if you want to keep them, has to be treated differently. Now, if you are working in an environment where you are operating under the confines of a collective bargaining agreement, then some of these ideas may be a little bit more difficult to implement. But we're at a point, as I said, where I think we need to consider not only how do we maximize the skills and the experience of our competent RNs in support of the younger RNs, are we willing to make the commitment to the late career RNs to do things differently for them, to treat them differently, to provide them with different opportunities? I think it's important. But I think even overarching all of this is I think we are now at a point where just the whole notion of our nurse staffing models has to be revisited. I'm not going to spend a lot of time. I recently did a presentation on the history of nursing shortages in America, and the first of those that was documented goes back to the early 1930s. And while much has changed over that period of time in the practice of medicine and the delivery of healthcare, there are some things that we really could learn from some of the strategies that were used back in the 30s and 40s. And I think just completely rethinking how our nursing workforce is constructed. How can we fully gain the benefit of those that have a formal BSN level education? Can we supplement those roles with other care providers, perhaps that are educated differently than they are today? But in the short term, with what's within your control, again, this idea of differentiation where you're making sure that you're utilizing your experienced RNs intentionally as a resource to support and develop your novice nurses, and taking a look at doing things differently, different schedules, different rotations, different benefits, perhaps, all of which may make a significant impact on your ability to retain that portion of your workforce. Lastly, and the fourth point that I would like to make is if there was ever a time to do something that was innovative, or the need to innovate in terms of our staffing practices, that time would be now. And when we look at opportunities to innovate, examples would be COVID has shown us just exactly what the capabilities of telemedicine are. And not that one would say that much good has come out of the pandemic, but certainly a greater acceptance and understanding and implementation of telehealth, you could say, is a positive development for many that has come out of this. But we need to be relentlessly seeking out opportunities for further innovations in our staffing methods, in our staffing, how we think about staffing, and how we actually execute our strategies on a day-to-day basis. Increasingly, U.S. healthcare employers are coming to terms with this supply and demand imbalance that exists. I will say this, I say this pretty much wherever I go. Healthcare employers today do not have a recruiting problem. Okay? You don't have a recruiting problem. You have a supply and demand problem. And those two things are very different. They are not the same. And the response to a recruiting problem is entirely different than what the response to a supply and demand problem would be. When we think about recruiting in its traditional sense, really, there's a couple of key aspects. One is we've touched on is making sure that you're hiring an appropriate number of new graduates and replenishing your workforce that way. But the rest of traditional healthcare recruiting is focused on simply you trying to hire five people from a competitor faster than that competitor is going to hire 6 people away from you. So aside from the new graduates, there's really no focus on adding to the supply of the workforce. Most traditional and most facility-based recruitment these days is simply focused on trying to get more of theirs than they get of ours, very simply said. And this is not a criticism of recruiters in any way, shape, or form. The work that recruiters are expected to do in this environment is more challenging than it's been at any time in the past. That's recruiting. Supply and demand says if you have an imbalance, one of two things has to happen over time. Either the demand has to come down, and there's no indication that the demand for healthcare services is going to be reduced in the United States. In fact, the only point of discussion there may be just how quickly is the demand going to continue to increase as the population ages, as the population grows, and as the government becomes a larger payer in the system overall. We find more people having access to the system. So we have really a triple whammy of demand drivers that tell us clearly there's no abatement in the demand for healthcare services. And quite frankly, what healthcare provider would want there to be a decrease in demand for the work that they do? So the question then becomes, how do we address the supply side? If we can't manage demand, how do we address supply? The educational system in the United States is a key element of that. And when it comes to nursing, I think it behooves all employers to advocate very, very strongly for the expansion of healthcare education in the United States. The challenge being faced in nursing, and many of you will know this very well, is not limited to nursing. We could be having a similar conversation around medical laboratory technologists. In some parts of the country, we could be having this same conversation around pharmacists. So looking to the educational system to expand and to respond is one of the highest priorities. But even at that, educating and graduating a new nurse is not a simple thing, and it doesn't happen quickly. So in this environment, what we are finding again now is that healthcare employers increasingly are looking to tap into a global supply of experienced mid-career nurses and other health professionals that are available to them, and individuals that have a great motivation to want to live and work in the United States. This is also not a short-term solution by any stretch of the imagination. But then again, we're not dealing with a short-term problem. We're dealing with an endemic, systemic challenge that all data indicates is going to be with us for the foreseeable future. So it also challenges us to look beyond solutions to our current urgent needs to ensure that we're also looking at considerations for our medium and longer term staffing needs, and how do we add to the supply? Well, one way of doing that, and increasingly a way that's being embraced, is to tap into this global supply of experienced mid-career, in the context of our conversation this afternoon, registered nurses. Every nurse that arrives in the US from abroad is not a nurse that has been taken or has left another employer and created a vacancy there. Every international nurse represents a net addition to the workforce. And today in America, 15, almost 16% of our entire nursing workforce in the country is made up of nurses that were educated outside of the United States. Without them, needless to say, the system would have collapsed some time ago. International nurses have made an important contribution to the workforce in the past. They continue to do so today, and I believe they represent a significant opportunity in the medium to longer term to make an impact on the supply and demand imbalance. Just a couple of points for your consideration. If you were to ever to consider the possibility of international recruiting, I think the benefits you would expect to be able to achieve would be in the areas of financial performance. If you're relying on contingent labor, travel labor, other types of increasing incentives maybe being paid to existing staff, international recruiting, I believe, represents an opportunity to improve your financial performance. Staff morale, and I think everyone here is very well aware that the impact of chronic short staffing, that the impact of a over-reliance on contingent labor, these things are all factors that over time have a clear and obvious negative impact on staff morale, and diminished staff morale eventually leads to turnover, which undermines recruitment efforts. So I believe the international nurse is also able to help you maintain and even enhance the level of morale within your staff overall. Quality of care is an obvious one. Obviously, to be able to provide an appropriate quality of care, you need to have an appropriate number of appropriately skilled staff to do that. If you have any diversity efforts or priorities at your organization, international recruiting can certainly help you in that regard as well. And lastly, international recruitment practiced and over time as part of a medium to longer term strategy is going to start to provide you with some certainty of your recruitment outcomes. Just one more thing on this point, just very quickly. We have before us today in the nursing realm literally a twofold shortage. We've touched on both of these just very briefly today. The first being the headcount shortage, right? There's just simply not enough applicants to fill the number of open positions. It's really can be summarized that simply. We've also talked about and briefly explored this new phenomenon that is rapidly emerging of the experience complexity gap and how increasingly employers are facing this experience shortage. And in that regard, we discussed accelerating the transition of new graduates from being novice to becoming competent, making meaningful contributions to their workplaces, leveraging existing resources in the context of your experienced nurses. How are they distributed across your workforce? And could some redistribution of that experience benefit your organization overall? And then we talked about differentiation, the need to maybe entirely rethink our nurse staffing models, to take an entirely new look and be willing to do some very innovative, out-of-the-box things, specifically focused on retaining those late career registered nurses. In the realm of international recruiting, I'm not going to spend really any time here other than to say there's two distinct models of how you can undertake that work, and that's perhaps a conversation for another time. And just I'll leave us with this thought, and then I'll be happy to field any questions, comments that there may be. When the conversation does turn to international recruiting, it's always in the context of nursing. As I said, mentioned earlier, the shortages in nursing are not limited to nursing. They exist in many other areas of the healthcare system, including in our laboratories, in our therapy departments, even in some of our support positions of nurse aides, nurse techs, and others, as well as other allied health professionals. So international recruiting is something that could be thought of in spanning the organization far more widely than just nursing. So I'll conclude my comments and my presentation there, and I'll be very happy to take any questions, respond to any comments. If you have a differing point of view to anything that's been shared this afternoon, I'd certainly welcome the opportunity to have that conversation with you as well.